As a psychology major with knowledge of hormones and neurotransmitter, and as someone who is clinically diagnosed with major depressive disorder and anxiety disorder almost a year ago, I'm really eager about advocating mental health awareness. I myself have been taking medication since last year and going to therapy sessions every 2 months to function like a normal being and cope up with my traumas. I can say that depression can hit any person, even the strongest, smartest, most successful, and most religious ones. Depression can hit you any moment and there's nothing you can do to stop it. The gastrointestinal tract is responsible for releasing neurotransmitter and hormones like serotonin and dopamine, which affects our brain functions and moods. The lack of production of either of these neurotransmitter is mainly responsible for mental illness such as depression and anxiety. If the microbes in our gut are unbalanced, it can lead to less production of these necessary happy hormones and can cause stress as well as anxiety and depression symptoms. Neurotransmitter imbalance can cause depression, anxiety, panic attacks, and so much more. But it is okay if our brain cannot produce enough neurotransmitter and we need medication nor therapy to function. We should take mental health as a serious matter. We need to end the stigma and be the generation that replace mental health stigma with mental health support. There is no health without mental health because our mental health is as important as our physical health. Also, I just want to remind everyone to please always be kind and sensitive because you never know what people are going through. Some people are fighting battles we know nothing about.
I think to be able to get rid of the stigma going around depression, anxiety, and other mental illnesses, or just simply like stress, is to be able to accept the fact that everyone or most people deal with it, struggle with it, don't know how to handle it, and that it does affect their daily lives. I think a lot of people should be more considerate when it comes to this because it is truly a hard thing to deal with. I mean, for example, stress. Stress can contribute to low levels of certain neurotransmitters, which also affects the hormones and then affects the people or the person struggling with it. I think accepting how little we truly know about the chemistry can help us maintain perspective and expectations about the mental illnesses that we deal with. If anything, we should be able to make research observations more to help people who struggle with it. Understanding the complexity of depression and anxiety can be helpful for those who have been offered hurtful advice, such as being told to just forget about it. It is no easier for someone to forget they are depressed with someone who is also sick, for example, like cancer. Can you just be like, oh, just forget about it? You can't do that. Being realistic about the limitations of our knowledge can help us remember that for the time being, there is no one treatment that will work for everyone with depression. More often than not, an interdisciplinary approach is needed. At the very least, every person dealing with depression needs and deserves a support team.
As a psychology student, I'll use my knowledge of hormones and neurotransmitters to persuade others to stop stigmatizing clinical depression and anxiety disorder. By sharing information about this disorder that is intended to reduce stigma and assist those who may be suffering from mental issues to become more educated and take measures necessary to seek help. Millions of individuals suffer from anxiety and depression, which is often stigmatized and misunderstood. Anxiety issues do not indicate a lack of strength. Genetics, environmental variables, brain chemistry, and life experience all play a role in their development. Generalized anxiety disorder, panic disorder, post-traumatic stress disorder, obsessive-compulsive disorder, social anxiety disorder, and specific phobias are examples of anxiety disorders. While depression is more than just sadness, it is marked by paralyzing weariness, a sense of helplessness, anger, and feeling of emptiness. It can range from mild to severe and it might strike people at specific seasons of the year, such as postpartum depression or seasonal affective disorder. People with untreated depression have significant lot of trouble functioning in their daily life. Depression treatment can highly successful in alleviating symptoms of despair and inability to function. People who suffer from treatable illness are often stigmatized, leading them to try to act as if nothing is wrong and avoid seeking care. Untreated anxiety and depression can lead to more serious issues, such as a desire to self-medicate with alcohol or drugs or suicidal behaviors. The purpose of this information is to teach individuals that unless they seek professional treatment, part of depressed or anxious person conduct may be beyond their control. Everyone from bosses to family members of afflicted individuals should learn more about depression and anxiety. And people who may be suffering from one of these disorders should know that seeking assistance is the proper thing to do. Don't try to deal with anxiety or depression on your own. If you or a loved one think you might have a problem, help is available and it makes significant difference in these circumstances. Begin by speaking with a family physician or a mental health expert to get an appropriate diagnosis and begin a treatment plan. Medication, psychotherapy, or both may be a part of treatment approach.
To end the stigma, first, give them information about how hormones and neurotransmitters work in the body. Second, correlate the given information to clinical depression and anxiety disorder. This way, they can disregard their predisposition about the two conditions and make educated guesses of why they have this. That being said, let's start with hormones. Hormones are chemicals that coordinate different functions in our body by carrying messages throughout the body in our organs, skins, muscles, and other tissues. It controls many different bodily processes including metabolism, homeostasis, growth development, and mood. Second are neurotransmitters. They are indigenous chemicals that allows neurons to communicate with each other throughout the body. They enable the brain to provide a variety of functions throughout the process of chemical synaptic transmission. These endogenous are integral in shaping everyday life and functions. Hormone dysregulation occurs when too much or not enough hormone is released by the endocrine system. Hormonal imbalance can cause or worsen symptoms like insomnia, mood fluctuation, anxiety, or depression. In women, thyroid imbalances may occur during periods of hormonal fluctuations such as menstruation, pregnancy, postpartum, and menopause. Lifestyle factors such as poor sleep, poor eating habits, not getting enough exercise, or existing medical conditions that can lead to chronic stress, which can result in hormonal imbalance that contributes to mental health issues. Hormonal issues often linked with women. It's not uncommon for people of all sexes and genders develop an imbalance. As for neurotransmitters, gamma-aminobutyric acid, GABA for short, is known to be a regulatory center for anxiety. Norepinephrine and epinephrine are responsible for many of the symptoms of anxiety. These hormones and neurotransmitters are responsible for the adrenaline and energy that is pumped throughout the body when you're stressed and anxious. If the given information is not enough, they can expand the knowledge she possesses, study, talk to medical experts, scholars, etc., educate others to end it, and give a better understanding of it. So if that the person going through it doesn't feel discriminated and embarrassed about a serious mental problem.
Student, I will use my understanding of neurotransmitters and hormones to prevent other people criticism of people who suffer from clinical depression and anxiety disorder by explaining and educating them about what happens to people who suffer from depression and anxiety, as well as the difficulties they face when their disease strikes. Anxiety disorders are characterized by excessive persistent and severe worry and terror about ordinary circumstances. Anxiety disorders are frequently characterized by recurring episodes of acute anxiety, fear, or terror that peak within minutes, or panic attacks. Meanwhile, a person suffering from clinical depression will have slow thinking, speech, and movement, feelings of worthlessness or remorse, as well as ruminating on past failures or blaming oneself, thinking, concentrating, making judgments, and remembering things are all difficult. Death thoughts, suicide attempts, or suicides are frequent or repeated. Furthermore, because we are in the Philippines, when a person has anxiety or depression, they always say that they are just acting all the time or they can do anything, and that they just need to pay attention because they don't realize that sometimes the person they are talking about becomes ill and commits suicide because they can no longer cope with their condition.